So if you asked me this question 15 years ago about whether or not it's safe to do cosmetics, I would have sort of said to you, please don't, because we just don't know. Now practicing in Beverly Hills after so long and watching many of my patients get older with me and get healthy and be in remission, I've done a lot more cosmetic procedures in them with safety. So I think that everybody's risk is individual depending on where they are in their disease and where they are in treatment and what kind of treatment and how risky their treatment is in terms of immunosuppression. But in general, Botox is probably safe. Fillers are probably safe. Those PDO threads for lifts are probably safe. I'm not going to comment on plastic surgery like breast augmentation. I can only comment on the things that I do. The other things that nobody asked about were lasers, resurfacing, chemical peels. It really kind of depends on how predominant your skin lupus is, whether or not I would feel comfortable doing lasers and chemical peels. But a lot of women have leftover redness from the malar rash, but their disease is not active. And we feel comfortable using intense pulse light lasers on those to help that out. It doesn't always work as well as if it's just for rosacea, but it helps a little bit. And we've done the fillers with safety. I have somebody asked if I've seen anybody react to the fillers, and the answer is yes, I have. Where we've seen people develop nodules, delayed nodules in their skin, but we see that in people who are also not having lupus or active autoimmune disease. And that is not totally understood. We think that may be infectious, not just immune response. And that sometimes has to do with technique. Did we breach sterility and bring a needle in with and bring bacteria in with us, et cetera? Or are you just reacting to a particular filler but won't react to others? We have lots of good treatments for it. So it's not a very dangerous reaction. It's just more annoying. And we would dissolve the filler out, treat with antibiotics, and people do fine. So if somebody is really a new lupus patient, unstable, I wouldn't do this. But if you're doing fine, have a flare on occasion, and your rheumatologist says it's okay to do the procedures, then I think it's fine. But I will put a plug in for a board certified dermatologist or plastic surgeon, more a dermatologist, I think, because we handle the inflammatory reactions or the inflammatory rashes of lupus more commonly than a plastic surgeon would. So I would avoid very much going to any med spa or any non-dermatology, non-plastic surgeon injectors just for safety reasons, and certainly not go to someone who's not a physician really because of the added risk to this.